Hi, my name is Wilma Varela, and today I'm going to be talking about the respiratory disease of Sars, which is also known as a severe acute respiratory syndrome. And the definition of Sars is that it's a contagious and sometimes fatal respiratory illness of zoonotic origin caused by the Sars coronavirus. And here we can, this is an image of the virus itself. Now, the virus originated from China, where in 2002, in the late 2002 to 2003, there was a huge epidemic. Over 8,000 cases occurred and over 700 deaths worldwide occurred. So it's very contagious, and those who catch it has a 1 to 16 chance of dying. Now, the mode of transmission is that it's transmitted through droplets, respiratory droplets, and also through person-to-person contact. Now, the signs and symptoms that we need to keep in mind when it comes to these patients is that in the early stage, there will be a flu-like symptoms, which is shortness of breath, dry coughing, and fever. And within a few days, the patient will develop pneumonia. They will struggle to get air into their lungs, and later, if not treated, fluid will accumulate in the lungs, which can lead to death. So the disease progresses very quickly, and the patient needs immediate attention in order to prevent death. Now, this is an x-ray of a patient with Sars in the initial stage and also in the fatal stage. And you can tell here in the fatal stage that there is fluid accumulation in the lungs, and it looks pretty bad. Now, the interventions that we need to keep in mind as nurses is that you can treat it with antibiotics, supplemental oxygen, and mechanical ventilation. And we also have to keep in mind that it's not a bacterial infection, it's a virus, so we cannot treat it with antibiotics. They're ineffective when it comes to viruses. And as of today, there's no vaccine to prevent the spread of the SARS virus. The most effective thing that to prevent the spread of the disease is basically isolation and warranting. And we need to keep these patients in a negative pressure room. We also have to keep in mind that we need to wear our gown, gloves, and mask when we care for these patients. Other preventive measures that we can keep in mind is hand hygiene. It's the most effective way of preventing any infection. And also disinfecting of surfaces, avoiding contact with bodily fluids, and washing the personal items of someone with SARS in hot, soapy water. And if there's a child that has the infection, we need to keep them home and not send them to school. We also have to keep in mind that there hasn't been any reports of the virus since 2004. So they're doing a pretty good job of preventing the spread of SARS since the huge epidemic in 2002 and 2003. I'm also going to leave a link underneath of a very interesting film that I found on YouTube about the virus and the epidemic that occurred in 2002. It's very interesting, and I'll leave the link underneath for anyone that likes to watch it. Okay.